And where's my slide? I was trying to help you. I don't think I have a slide.
You're important enough for a slide.
It's off to a very bad start. Oh, I definitely don't want the nightclub.
There you go.
There we go. Thank you very much for inviting me here today. Phone's on silent. A lot changes from opposition to government. I've gone from an office of 7 staff to a department of 3,500. People insist on calling me by my title rather than my name. And the most frustrating change, and I'm sure I won't be the first to have said it, has been the pace or lack of it at which the Whitehall machine works. So for ARA to have published 2 reports in the past 2 weeks, both over 100 pages long, packed with expert analysis and huge amounts of data, is really putting the British state to shame, especially when the first of those 2 reports he put together in just 2 months. He is on a one-man mission to solve our country's productivity puzzle. But the Darzi investigation into the NHS and the final report of IPPR's Health and Prosperity Commission complement each other. Taken together, alongside the OBR's Fiscal Risks and Sustainability report, they depict a perfect storm of rising pressures on the NHS, growing numbers dropping out of the workforce, and spiralling costs to the public purse, at a time where there is already a £22 billion black hole in the public finances. This is what we are up against. I've been in the Department of Health and Social Care for 2 months. Day after day, I'm shown graph after graph with all the lines going in the wrong direction. Recognising this is criticised by some for being gloomy. It's not actually. It's something this country hasn't been used to for a long time. It is honesty. This country has had enough of politicians who turn a blind eye, brush issues under the carpet, and delay decisions until after the ever-looming next election. This government has resolved to be honest about the problems facing our country and serious about solving them. You saw both in Keir's speech last week, honesty about the state of our NHS and a serious agenda for turning it around. As the Prime Minister set out in his speech, continuing with the status quo isn't an option. Sticking plasters won't cut it. We're going to have to make big changes, many of which will come up against loud opposition. So don't be surprised that we are making the case for change at the same time. If anyone was in any doubt about the scale of the challenges before the NHS, then the Darzi investigation published last week made it abundantly clear. I asked ARA for hard truths, warts and all. He delivered, and then some. He has given a raw and honest diagnosis. The promise that the NHS will be there for us when we need it has been broken for almost a decade. 100,000 infants aged between 0 and 2 were left waiting more than 6 hours to be seen in A&E last year. Cancer is more likely to be a death sentence for NHS patients than patients in other countries. 50 years of progress on cardiovascular disease is going into reverse. And patients have never been more dissatisfied with the service they receive. The report is equally damning on the causes. First, a decade of underinvestment, which left the NHS 15 years behind the private sector on technology, with fewer diagnostic scanners per patient than almost every comparable country, including Belgium, Italy and Greece, and mental health patients treated in Victorian cells infested with vermin, where 17 men are forced to share 2 showers in 2024. Second, the disastrous 2012 top-down reorganisation led by Andrew Lansley. As the report states, and I quote, "It took a scorched earth approach to health reform, the effects of which are still being felt to this day." Just imagine if all the time, effort, and billions of pounds wasted on dissolving and reconstituting management structures had instead been invested in services for patients. Clearly, the NHS would not be in the mess it finds itself in today. Third, coronavirus. The damage caused by the pandemic has been plain to see. But what we didn't know until the Darzi report is that the pandemic hit the NHS harder than any other comparable healthcare system in the world. Patients in this country saw far more operations and routine care cancelled than anywhere else. It's not just that the Conservatives didn't fix the roof while the sun was shining. They doused the house in petrol, left the gas on, and COVID just lit the match. That is why the backlog ballooned to 7.6 million today. When I used that metaphor in the House of Commons last week, a Conservative MP from the Tone Police Department told me that my tone was inappropriate and not befitting the chamber. It felt very much like an arsonist heckling the fire brigade. Fourth, the failure to reform. A 17% increase in staff working in hospitals, which didn't lead to better outcomes for patients, but a huge fall in productivity. Staff put into the wrong place without the tools to do the job. Instead of treating patients, too many are trying to find them beds, find somewhere to discharge patients, or dealing with slow, creaking, outdated IT. An enormous waste of talent and money when so many other parts of the NHS were crying out for investment. And the effective reforms implemented by the last Labour government, which drove better performance and better care for patients, were mostly undone. Activity-based funding was ditched in favour of block contracts. Incentives to reform and modernise ways of working have been stripped out. Translated into plain English, too many parts of the NHS are now paid for effort, not for outcomes. That has to change, and we will be saying more about that in the coming months. Some of the most shocking findings in the Darzi investigation weren't about the sickness in our National Health Service, but the sickness in our nation. Children are sicker today than the generation a decade ago. Adults are living longer, but falling into ill health earlier in life. And as this report from the IPPR puts it, we are in danger of literally becoming the sick man of Europe. The result is a rising tide of pressures on the NHS. I've said it before, but I don't think the message has yet got through. If we don't act now, ever-increasing demands for healthcare threaten to overwhelm and bankrupt the NHS. Our sick society is also holding back our economy. A drop in productivity due to ill health has cost our economy £25 billion since 2018. 900,000 more people are off work than would have been on pre-pandemic trends. That's more people than Tesco, Sainsbury's and Asda employ put together. Fail to act, and by the end of this Parliament, 4.3 million people could be off work sick. Millions of people left behind, the welfare bill ballooning, and growth hampered. To build a healthy economy, we need a healthier society. To achieve that, we need reform of the health service and public health reform too. That was a great thing about the Darzi report, and actually about IPPR's conclusions today. This is not a left-wing or a right-wing view of the NHS. It's hold hard truths to both sides of the debate, and it forces me now to take on both left-wing and right-wing orthodoxies. I've got two voices on my shoulder in this debate. For simplicity's sake, we'll call them The Guardian and the Daily Mail. The Daily Mail says, "We're encouraged by what you're saying on NHS reform. You're the only party that can do it. Now get on and deliver. But we can't stand this nanny state stuff. You need to stop." The Guardian says, "You're absolutely right on prevention, and we love nothing more than filling our comment pages with pieces about the social determinants of health. But we're nervous about all of this crass talk of NHS reform. It sounds far too much like Alan Milburn, and we've heard he's back, which is terrifying because he makes that Streeting look left-wing." Both are half right and half wrong. The lesson from the Darzi report is clear. The Tories did neither. This government has got to do both. Unless we do public health reform, the right will have to accept higher costs for healthcare, paid for by higher taxes. I don't think that's a price working people can afford to pay. The left have to accept health service reform, or there will be no health service, at least not as we currently recognise it. Reform has always had opponents, often vocal and powerful opponents. But believe me when I say, the Prime Minister and I will face down that opposition because it is in the interests of patients, the health service and taxpayers in this country. It really is reform or die, and we choose reform. As the Prime Minister said last week, radical surgery is required. We will publish a 10-year plan early next year that will set out how we will deliver 3 big shifts in the focus of the NHS, from analogue to digital, hospital to community, and sickness to prevention. And what gives me confidence that this can be done is the innovation we already see taking place in our health service and our country today, pointing the way to a better future. At the Royal Free Hospital in London, the hospital which treated my kidney cancer, new PET scanners work 4 times faster than standard. Patients are seen days, not weeks, after being referred, cutting delays in diagnosis that can be the difference between life and death. Think of the number of lives that could change if rolled out across the country. That is why we are committed to putting an AI-enabled scanner in every hospital, freeing up valuable staff hours and getting patients diagnosed much faster. In the southeast of England, virtual wards have led to 9,000 fewer hospital admissions per year. Patients living with long-term conditions like heart failure are cared for from the comfort of their own home, freeing up vital hospital beds and saving more than £10 million. Our commitment to invest in more district nurses will make sure more patients across the country can get the treatment they need without having to step out the front door. Better for patients and less expensive for the taxpayer. And as the Prime Minister said last week, by marrying our country's leading scientific minds with the care and compassion of the NHS, the fruits of the revolution taking place in life sciences can be secured for NHS patients. That public-private partnership will be fundamental to the reform agenda. Take MS patients. Right now, many are treated through a 4-hour blood infusion, a long and difficult ordeal. Soon, thousands will be offered an injection that takes just 10 minutes. Just imagine the difference this will make. The hours returned to patients to live their lives, and the thousands of hours of clinicians' time freed up for the millions of other patients stuck on waiting lists. And when it comes to prevention, the healthy society we need to build won't just come from the action we're taking as a government to ban junk food ads, pass the tobacco and vapes bill, or introduce health checks in workplaces and on high streets, nor will it only come from the reforms we will make to the NHS so that it can reach patients sooner, diagnose earlier, and treat them faster. In May, we saw the first NHS patients be treated with a personalised cancer vaccine at University Hospitals Birmingham. These vaccines could prevent cancers from returning after surgery, sparing thousands of patients and their families the torture of recurrence. That's why I am determined to rid my department and the NHS of any cultural sniffiness about dealing with the private sector. Make the NHS the best partner in the world for the life sciences sector, and make sure that NHS patients reap the rewards. That is what Keir Starmer's mission-driven government is all about. It's about mobilising the public sector with business, the voluntary sector and civil society to achieve big, lasting change for our country. And in doing so, we won't just be building a healthy society, but playing our part in contributing to the government's #1 mission of economic growth. So in conclusion, we've hit the ground running in the past 2 months, bringing an end to the junior doctors' strike, which had lasted 18 months, cost patients £1.5 million cancelled operations and appointments, and cost taxpayers a staggering £1.7 billion. And we've begun to fix the front door to the NHS, with an additional 1,000 GPs hired by the end of the year, beginning to reverse the decline in primary care of the last 14 years. It's 76 days since the general election and 76 years since the founding of the NHS. There are no quick fixes for an institution of this size and age, especially when the damage done by the Conservatives was 14 years in the making. None of this will be easy, and it will take time. And there will be more arguments to be won along the way, against the ideologues who don't believe the NHS should have any relationship with the private sector, and the modern-day Luddites who resist greater use of technology in the health service. This government will never be afraid to take on those arguments and take the difficult decisions needed to deliver the change that the British people voted for. If we see this through, the prize is huge. A healthy nation where fewer lives are lost to the biggest killers and fewer people are forced out of work through preventable disease. A healthy, growing, prosperous economy with the proceeds of that wealth shared across our country. An NHS there for us when we need it once again, recovered, reformed, sustainable for the long term. And that is what we will deliver. Thank you very much.
Thank you. Thank you, Wes. Thank you, Wes, for that really powerful speech and huge progress already, so congratulations. I'm now going to open up to questions. We're going to do this in two parts. So we're going to take questions from journalists first, and then questions from everyone else afterwards. So if you're a journalist, please can you put your hand up, and if you're not, can you restrain yourself for just a little moment? Thank you.
They're all on the front two rows, the entitlement of our media. Shocking.
Can I take Ali Fortescue, Sky News, please?
Thank you, Secretary of State. We've spoken to Donna Ockenden today, who I'm sure you know has been looking at maternity services and the continued failings that she says are putting mothers and babies at risk. She's told us that she wants an urgent meeting with you. Would you be happy to do that, and if so, when? While I've got you, can I also ask on the row over donor gifts, some of the reporting today about you accepting Taylor Swift tickets? You're seen as a straight talker. Can you tell us, do you think this whole row has been overplayed, or do you understand the strength of feeling? Thanks.
Two things. The first one, yes. I have a huge respect for Donna Ockenden, and when it comes to the crisis in our maternity services across the country, it is one of the biggest issues that keeps me awake at night, worrying about the quality of care being delivered today and the risk of disaster greeting women in labour tomorrow. I think that what we've seen in the case of specific trusts are problems and risk factors that exist right across maternity services across the country. And we're keen to make sure that when it comes to the work that Donna Ockenden has already done, that we make sure that those lessons are applied not just in the case of those specific trusts, but actually right across the country. And we're determined to get this right. Look, secondly, I'm now outed as a Swiftie. Look, I think the important thing is transparency and accountability, and that there are no conflicts of interest. And that is why we have the transparent system that we have. I think that is a good thing, and long may it continue.
Fantastic. Can I take Kate Devlin from The Independent?
Thanks. Kate Devlin from The Independent. It's been announced that Joyce Parker Hospital in Coventry is to shut following an expose by The Independent of allegations of shocking practices there. Can I ask for your comment on that, and how important do you think it is to shine a light on these kind of problems?
Well, firstly, sunlight is the best disinfectant. And the reason why on day one I came in and said the NHS was broken was because that candour about the state of the system today from the Secretary of State gives permission and provides leadership to everyone working across our health and care system to be honest about the things that they are seeing, experiencing, and often terrified about in their daily working lives. When you have a political culture that seeks to prioritise protecting political reputations over protecting patients, you breed a culture where patients are more at risk. If you are not prepared to confront hard truths about the state of maternity services, long waits in A&E, the struggle people face getting a GP appointment, the lottery of an early cancer diagnosis versus a later cancer diagnosis and the impact that has on your life chances and life expectancy, you end up with a situation we're in today, which is a system that, despite amazing professionals who care very much about their patients, we see an appalling state of failure which is letting patients down. And so creating that culture of honesty about the challenges means that we will be able to meet those challenges. You know, as we said around the Darzi investigation, if you get the right diagnosis, you're more likely to write the correct prescription. So that transparency is really important, that honesty is really important, and you will not find me ducking hard truths over the course of this Parliament, especially because we're not going to fix these things overnight. On that case specifically, it is truly shocking the way in which children were treated in a place where they were supposed to be safe. I think the closure decision is the right one. We're working to make sure that that placements, appropriate placements are provided for those young people. And I think it is actually a truly terrifying example of what happens when patient safety is not taken seriously. I don't want to read about any more of these sorts of cases, and we've got to make sure that in everything we are doing throughout our health and care services, the safety of the patient, the safety of the care user is the first consideration.
Can I take Chris Hope now?
Chris Hope, GB News. Secretary of State, you once told me you wouldn't ban bringing cake into offices, if you remember. Is that still the case now you're in government? And has the nanny state gone too far by banning smoking in pub gardens? And just finally, it's a very nice suit. Did you pay for it yourself?
I did. Thank you very much. I always take compliments where I can get them, especially from you, Chris. Look, a couple of things. I have not banned cake in the Department of Health. In fact, I was at NHS England the other day and saw an abundance of sugary treats around the building. I've not reported them to the Chief Medical Officer yet, but there's a serious kind of point. There's a serious point here. I'm really not interested in being the fun police or telling people how to live their lives, and people certainly won't have to worry about closing their curtains at night in case I'm peering through the window and looking at what they're eating, drinking, or smoking. That's not the kind of society I want to live in. But we do have to take this issue of chronic disease seriously, and the impact it's having on our lives, our life expectancy, our ability to live our lives to the fullest extent for the longest time possible. I think we are in this appalling situation at the moment where we are living longer but becoming sicker sooner. That is terrible for quality of life. It is also terrible for the economy, for the labour market, and for the financial sustainability of our health and care services. So when it comes to having some cake or going down the pub, I think everything in moderation. And crucially, when it comes to measures we are considering, especially if this involves legislation, I don't believe in doing things to people, I believe in doing things with people. We want a genuine national conversation about our health and our well-being and the types of reforms that we might want to see. Smoking's at the easier end of the spectrum, frankly. It is still the biggest killer. It is uniquely harmful, it is uniquely addictive, and there are unquestionably harms that occur through second-hand smoking and passive smoking, and we've got to take that seriously. But we're going to consult, we're going to engage, and we're going to enjoy the national debate in the process.
I'm going to take two more journalist questions, so any journalist, put their hands up. Lady in the front here with the white top.
Thank you, Eliza Parr from Pulse. One of the key recommendations from the IPPR was moving to a neighbourhood structure, which essentially means doing away with the GP partnership model. But last week, Lord Darzi said that GP partners have the best financial discipline in the NHS. Where do you stand on that, and what are your plans for the independent contractor model?
I don't think building a neighbourhood health service means moving away from the GP partnership model. I started deliberately a debate on this by making everyone really angry with an interview in the Times in January the other year, deliberately to provoke a debate about the future of the partnership model, because what I observed was a partnership model that's in decline, where very soon we're going to have more salaried GPs than partnered GPs, and where GP partners themselves are describing anxieties about the future of their profession generally and about the future of the model specifically. And we said we were genuinely interested in debate and we want to work with the profession to rebuild general practice. And actually, I think, as Ara's investigation shows, that there are actually some enormous strengths that come with the partnership model in terms of the efficiency, the innovation, the continuity of care that doctors are really committed to providing. So the model, the partnership model itself is not my first consideration. My first consideration is how do we make sure that general practice is attractive to people thinking about careers in medicine, and how do we do more in primary and community and get some of those services shifted out of hospitals closer to where people live. So I think this is kind of a good example of how when we say we're going to consult and we're going to engage and we're going to listen, we genuinely mean it. I know when most people hear a politician say we're going to consult, they think we mean impose our view. with a veneer of public engagement. That's not how we will proceed. Where we're clear about what we want to do, we'll say so. Where we're engaging and consulting, it's because we're genuinely interested in finding answers to our questions. The final thing I'd say in relation to general practice, I think GPs are really up for reform. I think they are desperately anxious about the state of general practice. They want to see the left shift, and they want to see this government really deliver on our ambitions for general practice and primary care. That is why the confrontational approach of the BMA's GP committee is unfathomable. I can totally understand how they ended up in conflict with the last government. I'm still struggling to understand why they want to pick a fight with this one.
It's up to you to do the left shift, Wes.
I'm always being told to do the left shift, but I'm firmly in the centre.
Sophie Huskinson from the Daily Mirror.
Hi, thank you. So IPPR in the report recommends free school meals for all primary school children. Doctors, dentists, teachers all wrote to you last week calling for the same thing. Is this something you'll consider introducing? And secondly, if I can, how do you feel about people having to sell their homes to pay for social care? And when are you going to introduce a cap on costs?
So two things, and they're both related. There are lots of things that we would like to do, but we are constrained by the state of the public finances, and this is precisely why we have to keep economic growth as the #1 mission of this government, and why all of us have a responsibility to drive towards that growth, because when the economy is growing, you can invest in public services and put more money back in people's pockets without having to increase the burden of taxation. We have a fiendishly difficult challenge in the public finances, far more difficult than we anticipated. Yes, we knew the economic outlook was poor, and that the previous government had been both irresponsible with the public finances and irresponsible in terms of their stewardship of the economy. What we didn't expect to find was the extent to which they were spending money that the government simply did not have, spending the National Reserve 3 times over, an unprecedented amount of in-year profligacy, and a level of spending that we've never seen outside of the unique circumstances of the pandemic. That is why we are having to make hard choices, and they are not just the Chancellor's hard choices. This is a shared endeavour, and look, we recognise that when we talk about hard choices, those are hard choices for the country too, and as the Prime Minister will set out next week at the Labour Party conference, by taking the hard decisions now, we are fixing the foundations to build the brighter future that we want to see for our country. So there are lots of things people are going to want to see us do. You're going to have to get used to us saying, as the resources allow. And finally, and this is a good case point, the deal not charging reforms. I think it is outrageous, actually, that the last government promised to introduce charging reforms in October next year, when they must have known full well the advice that I received on day one in the department, which is, firstly, if the money was there, the preparation hadn't been done to actually roll out the charging reform. So operationally, the system wasn't ready. And secondly, the money wasn't there. So they went into that election and lied to millions of people across the country, creating false hope and false security. And that is not the way this government is going to behave.
Fantastic. I'm now going to take a round from the audience. I'm going to take a couple. So there's a pen there if you want to note anything down. Ben, can I come to you? There's a microphone coming over.
If someone could pass my glass of water up from there, that'd be really great.
Hi, I'm Ben Richardson, Managing Partner at Carnell Farr. It's a specialist in healthcare consulting and data. We observed in Darzi's report calling attention to the amount of money spent on the acute rising from 49% of the NHS budget to 58%, so the precise inverse of the stated policy of left shift. And I wondered if you were prepared to make any specific commitments about either the quantum of money or the processes and capabilities in the NHS, because when we talk with our clients across the NHS, many of them reflect that they no longer commission services, they just roll the money over, and they've stopped the practice of looking at the return on investment. So I just wonder your thoughts on those two things.
I'm going to take, I take a couple, is that okay?
Yep.
Yeah. The lady just here in the green top. Yeah, there's a microphone coming around.
Thank you, Lucy from Rethink Mental Illness. Thank you for brilliant report and great speech, Secretary of State. Hugely recognise and welcome the recognition that mental health is getting at the moment. But with we're seeing increased suicide rates, we're seeing really twice as long waits for mental health treatment for people in community services to elective surgery. And just wondered if you could talk a bit more about reform, and if that includes fair funding, recognising a previous report that IPPR have done where fair funding for mental health services is often significantly under-prioritised. Thank you.
And I'll take one more. The gentleman just here in the checkered shirt. Yeah.
It's Andy Cowper from Health Policy Insight. Secretary of State, last week's Darzi review highlighted the £13 billion NHS backlog and maintenance funding need, and today's IPPR report highlighting a future generation health plan. Now, both of these would require spending. Given the government's fiscal plans, do you have any thoughts in progress about where you might disinvest to be able to fund those things?
Good questions.
Over to you, Wes.
Firstly, on specific fiscal announcements, I'm definitely not going to get ahead of the Chancellor, ahead of a budget and spending review, because I know what's good for me. What I will say is two things. Firstly, I am committed, and the government is committed to growing the proportion of the NHS budget that goes into primary care. That change takes time, and it needs to be underpinned by a credible reform agenda. But that's the commitment we want to see. Money tells you about priorities. So we'll make sure that we follow the money in the right direction to really underpin, in a meaningful sense, the shifts that we're describing. And then, in some ways, that also links to Andy's question. I am determined to break the doom loop that we are stuck in, where day-to-day pressures in the NHS and a lack of control on those pressures and those budgets leads to the raiding of capital and tech budgets to plug day-to-day shortfalls. It is short-termist, it is harmful, and ironically, raiding tech and capital budgets to plug day-to-day pressures just makes it harder to contain those day-to-day pressures into the future. So it is a doom loop which is really undermining productivity in the system. That is why my approach to the forthcoming spending review is to look at where we can put our investment on the capital and tech side to improve productivity within the system. I have to be honest with everyone, it is not going to be possible in a single budget or a single spending review to correct 14 years of underinvestment. It does take time, and that is why I think prioritising those investments that will unlock productivity gains and save money and improve the experience of patients has got to be the priority right now. And then on mental health, we've committed to Mental Health Act reform. That was in the First King's speech, and I look forward to seeing the introduction of that bill in Parliament in the not-too-distant future. Many of the commitments we made in our manifesto were really at the prevention end of the mental health challenge. So, having mental health support in every primary and secondary school in the country, having walking community mental health hubs, it gives us a greater chance of getting there early before we see the acuity of mental illness escalate to the really appalling outcomes that too many, particularly children and young people, suffer. We also committed to recruit 8,500 more staff to help cut mental health waiting lists, and I want to shine a sharper spotlight on what I would call some of those more hidden waiting lists beneath the overall elective number that we tend to focus on. We've got to keep an eye on the mental health list. We've got to focus on the paediatric waiting list generally, by the way. I think it's shocking the extent to which we overlook children's health needs and health outcomes in this country. So we will do that. The final thing I think we need to take seriously is at the moment, especially when I think about those waiting lists for services which are stretched today, we've got to keep a focus on not just the mental health of children and young people, but the well-being of children and young people. And we've in particular got to manage the risk of overly pathologising those children and young people who have all sorts of stresses, strains, pressures that impact on their well-being, and just pat them off into a waiting list for CAMS alongside children who've got really quite urgent need. I think that's part of the prevention agenda. We've got to take that seriously and make sure that we equip particularly children and young people, but I think this applies to adults. I think particularly in terms of men's mental health, equip people with the tools, the resilience and the ability to kind of talk openly about stresses, strains and pressures, so we get there early, nip them in the bud and don't allow them to turn into serious mental illness, which is a real issue, particularly for children and young people. But when you look at young male suicide rates, this is an issue for adults too.
Thank you, Wes. I'm going to draw us to a close there. I'm sure there's lots more questions that people want to ask Wes, but we don't want to detain you too long. Thank you for your time. Thanks for making time to come and launch this with us here today, and we hope you find it a useful document as you work out how to solve the many challenges facing the health system in the UK.
Well, I appreciate that, and thank you to you and the whole IPPR team for the thought leadership you've shown in this space. It has been really helpful to us in terms of framing our priorities, our outlook and our policies. So long may that work continue, and thank you to all of you for not just engaging today, but no doubt rocking up in numbers to Labour conference next week, and the many other opportunities there will be to contribute to the discussion, to challenge and test the government on our priorities, and hopefully to be part of the team that we will need to build to take the NHS from what is objectively the worst crisis in its history to getting it back on its feet, making it fit for the future alongside great social care that we could all be proud of. So thank you very much.
Thank you, Wes.